To all who are new here, my name is Dr. Michelle Henney, and I'd like to welcome you to Releve Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar or sign up for the email list to be notified of upcoming webinars. We are continuing to update our schedule, so check back often. The information contained in the video content represents the views and opinions of the presenters and does not necessarily represent the views or opinions of Releve Sports Medicine. The mere appearance of video content on the website does not constitute an endorsement by RSM or its affiliates of such video content. The video content has been made available for informational and educational purposes only. RSM does not make any representation or warranties with respect to the accuracy, applicability, fitness, or completeness of the video content. RSM does not warrant the performance, effectiveness, or applicability of any sites listed or linked to in any video content. The video content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen on the site. RSM hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the video content, which is provided as is and without warranties. We are looking for an athletic trainer to join our team. This is a combined position working in a sports medicine clinic and in a university role. Please feel free to pass our information along if you know of a qualified candidate. More information regarding applying can be found on our website. For all athletic trainers who are intending to get live CEUs from the BOC, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz evaluation and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or have any other concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available for review from our website tomorrow. Our speaker this evening is Dr. Michelle Joy, who is a psychiatrist at the Philadelphia VA. She completed her undergraduate degree at Brown University, her medical school at Yale School of Medicine, and her residency and fellowship at the Hospital of the University of Pennsylvania in Philadelphia. She's presenting today on sleeping for performance.
Great, thank you, Michelle. And I'm going to go back to share screen and make sure everything looks okay.
That's perfect.
Do you see the slides now?
Yes.
Okay, and not presenter mode, right?
Correct.
Okay, cool. So today I'm talking about sleeping for performance. I have a mental health background, and so sleep is kind of the field of everyone, I would say. You know, it's important to all aspects of medicine, and today particularly speaking about sleeping for both physical and mental well-being and how that relates to performance. So basically the objectives briefly are to understand some of the basic physiology, kind of functionality of sleep, why it's important, what its benefits are for performance, and also to realize what the deficits are in general and for performance. So we'll kind of apply things both to training and athletics, and then to kind of general life, but with a focus obviously on performance and athletics. So sleep, to begin with, it's a very cute picture. It was kind of fun taking pictures or picking pictures for this slide deck. A lot of cute things sleeping, but every species sleeps, obviously mammals, but when you even think about it, insects, every species in the animal kingdom does sleep, and it's a pretty significant part of our lives. If you're averaging, which obviously there's deficits and such, but when you think about 8 hours of sleep a night, that's about, a third of human life. So it's a very significant human behavior that doesn't get necessarily a lot of attention when you think about how much of our life we spend sleeping, or how much we should spend sleeping and how important that is. It just doesn't get a lot of attention. And one of the reasons it's important is because it's not just this passive state. There is a lot goes on during sleep. So it's considered to be an active physiological state. Some parts that we'll talk about are more similar to wakefulness, and some are less similar to wakefulness, but it is an active state that has its unique metabolic, immunologic, and kind of cognitive processes going on. And that's why with impairment and deficits, you can have, those states are disrupted, that basic physiology is disrupted. So you can have both physical and cognitive impairment. And, you kind of hear stories of people that can be so sleep deprived that they die, but it really is so essential to life that we would die without it. The brain requires it to function. And there's different types of sleep. And really what we'll be talking on today is kind of the linkages between sleep, cognitive processes, and metabolic function, and why that's so important for performance. And when you just think in general about what performance is, it takes, so much both cognition and physicality to be a well-performing athlete, that you can understand why sleep is so important, because it kind of is the toolbox for all these different things that have to do with performance. So some of the functions of sleep, it's considered to be restorative and homeostatic. So things that are kind of disrupted during everyday life or extreme circumstances can kind of come back to baseline. That has to do, for example, energy production, thermoregulation. It's homeostatic, so it's, it's kind of that set point. You can think of it like rebooting a computer. If things are, going slow with your computer, or things are awry, kind of resetting it, bringing it back to its baseline is kind of what sleep can do. It is another important function of sleep is neuroplasticity, which is entailed in learning. So not only, we'll talk about that a bit, but not only does it kind of cement memories, but it also prepares the mind for new memories to be made. And sleep deprivation is really significant. Most studies show prolonged sleep deprivation. So most studies are not like as accurate because they're really almost in artificial conditions. But with deprivation, you can have disorganization of both thoughts and behavior. So you're kind of not goal directed, which obviously you could see how that would be important for any kind of performance, not just athletic. You can have hallucinations, delusions, really enter into a state of psychosis. With sleep deprivation, you have REM rebound. We'll talk about the different physiologic states of sleep, but just to recognize that REM does rebound. And that means that if you have a sleep deficit, when you go to sleep, the percentage of sleep that you spend in REM, which is rapid eye movement, increases. And just overall, REM increases basically throughout the night, longer periods of that. In rats, where a lot of the studies were originally done and some of the basic physiology studies done, you see that with sleep deprivation, rats have increased food intake, and despite that, they still have weight loss. So again, that's going back to this like importance of energy production and restorative homeostasis. For sleep, they are spending energy even though they're eating more. They have decreased body temperature, and eventually they die. So there are, it's not exactly parallel, but there are building blocks of that for why sleep is important for us. So the two different physiologic states of sleep are, and most people have heard of these, but just to differentiate them for a little bit, because they can become important when you're thinking about how much sleep to get and when to wake and things like that. So stages 1 through 4 are non-rapid eye movement sleep. Deep sleep is considered stages 3 and 4 of non-REM sleep, and that really there are bigger problems if you're awakened from that sleep. So, I mean, colloquially, you can think of the fact that if you're awoken from a deep sleep, it can be kind of disorienting. And that's true in terms of the physiology. If you're awoken in stage 3 or 4 sleep, you can become disoriented, disorganized. There can be bedwetting problems, sleepwalking problems, and also not just waking during that time, but that's also where people have bedwetting problems, sleepwalking problems, night terrors, things like that. It's a lower physiologic state, so it's more restful, peaceful. That's kind of how you think of the non-REM sleep, is that's more like what you would think of sleep, kind of a more passive, restful state. And then in REM sleep, rapid eye movement, it's a lot of brain activity actually. It has very similar physiology to wakefulness, so the body has higher pulse, higher respiration, blood pressure, and brain oxygen use. It's essentially every 90 minutes, but as I said, as you go through the night, it becomes increasingly long. The amount of time spent in REM, because each REM cycle is getting longer. And so when you think about it, if you're not getting enough sleep, that you're really cutting out a significant amount of REM, because that is saved up until you get further into sleep in the course of a night. So characteristics of sleep, essentially, that are what you think about as quality and timing of sleep. So we can think about both whether sleep is restorative and restful, and then also whether there's enough sleep. So with regard to quality, non-restorative sleep, you can actually get enough hours, get as many hours of sleep as possible, and you're still not getting sleep if it's, sleep quality, if it's non-restorative. Often someone that's getting non-restorative sleep, poor quality sleep, will be a light sleeper, have recurrent awakenings through the night. So even if you're, let's say, getting 8 hours total, but you're waking up for minutes at various points of the night, that would be considered non-quality, non-restorative sleep. And then you also think of timing of sleep, and that refers to obviously the amount of sleep, but also to circadian phases. So people, the colloquial term is a night owl, or early morning bird, I guess is the sayings. But basically each body kind of has a preferred sleep schedule, whether someone's someone's going to stay up late or wake up early preferentially. And that's also related to certain sports, as we'll see. But you want to think of both quality and timing of sleep. So when assessing someone ourselves, athletes, for sleep, it's important to ask not only about, how much sleep is being gotten, but the timing of when it happens, and also how the quality seems to be. So what does exercise do? We'll kind of move into general impact of exercise on sleep, and then go further into what it means for performance. So going back to those two physiologic states of sleep, what exercise does is it actually increases that non-rapid eye movement sleep. So you can imagine, we kind of referred to that as the more peaceful, restorative sleep. And so after anything, hard on the body after exercise, the non-REM sleep increases in order to better satisfy metabolic needs, to kind of take care of the stores that were lost, and basically restore the body to its homeostasis. Exercise can promote nocturnal sleep. So if you get good exercise, you might sleep more, and if you're sleeping more, you might be doing better exercise. I mean, that's kind of obvious, but even in medicine, if someone's not sleeping well, one of the things you might say to them is to try to get some exercise every day, the timing of which might vary, but really getting exercise is important for even non-athletes to have. If they have sleep problems, it can really have this reciprocal relationship where they both improve each other. And just in general, when you think of training, you think of rest recovery intervals, and sleep is its own kind of recovery interval for exercise. So not just like an off day in training, but also having sleep at night is important when you're exercising. So what kind of is the relationship between sleep and performance? First of all, it really puts athletes into a position for optimal recovery. You know, if it's increasing after exercise, it probably shows, and it does show, that it's important for people who exercise, both psychologically and physiologically. So it prepares, it both helps with recovery and prepares for subsequent performance. So you can imagine, which makes sense, right? If you're getting a good night's sleep, not only are you resting and recovering from whatever happened or whatever you did already, but you're also preparing for kind of the next phase where you'll be able to perform better. So again, this kind of bi-directional relationship helps with learning procedural skills. You know, you see sometimes in like movies or something, someone, you know, learns something on the piano and then plays it even better the next day, because it actually can help encode memories, which can be important for different sports. And most of the literature that I read showed that athletes, high performance athletes, have a higher need for sleep. And so the average person might need 7 to 9 hours of sleep, but a high performance athlete should function, should try to optimize sleep for about 9 to 10 hours, which it was interesting because they actually said one of the primary, the literature was showing kind of one of the primary interventions to do at first is just get athletes to sleep more, kind of whatever their baseline sleeping is. If it's 7 hours, try and get them to increase it by 1 or 2 hours to optimize performance. But in general, that would be 9 to 10 hours. So sleep deficits, when you think about sleep deficit, you know, it might not be, like a lot of the studies that bottom line says often with partial deficits, that might be, you know, one night in a laboratory or something. But when you're really thinking about sleep deficits, you're thinking about reduced sleep over consecutive nights. I mean, we could talk about the importance of not sleeping for one night, but I think in general, we're talking about, you know, sleep problems, poor sleep schedules, and all of these things that athletes might have that lead to poor sleep despite the higher needs. And so what I'm talking about in deficits would be, from the literature, I'll differentiate it, whether it's for one night or consecutive nights. But just in general, poor sleep is correlated with stress. Again, this bidirectional relationship, reduced glycogen, muscle storage. So again, and these are focusing, you know, these deficits that I'm focusing now are why it's important for performance. You're not going to have that background energy storage for exercise. It actually leads to neuroendocrine and immune dysfunction. So people get sicker. They also have harder time putting on muscle, things like that. And then specifically, it has like very specific impacts on athletic performance. So performance, meaning speed and endurance. I mean, we can talk about performance in a general sense, but also performance in the specific sense of how one performs. And the domains that are most affected are speed and performance. With regard to cognitive status, attention and memory are really impacted. And then something that I didn't think about at first, but is also important is, as relates to athleticism, is you're more likely to get sick. You're also more likely to get injured, and it can disrupt whatever kind of the intended weight profile is supposed to be. So if someone's trying to lose weight, it might make it harder to lose weight, or if someone's trying to gain, it might make it harder, depending on a number of factors. So also with partial deficits, so these are a lot of the studies. It was pretty interesting, and they get really specific, right? So you're going to have like a single episode of impaired sleep, but it's where a lot of the research comes from, because they're putting someone in a laboratory for a day, you know, and kind of looking at these things for 2 days. But what most of the studies found, and this is not just one study, this is from a number of studies, what's minimally affected in a single episode or a partial deficit of sleep are aerobic exercise and maximum strength. Isometric strength, maximum strength as minimally affected. And one of the studies showed that a 40-meter sprint was not particularly affected. I don't know why that stood out, or I know why it stands out. I don't know why that would be the case if that was just kind of flat, but it did show that the 40-meter sprint was not as affected. But in comparison to those things that are minimally affected, you have these really specific sports-specific skills that can be affected. So that includes submaximal sustained exercise bouts, muscular and anaerobic power, and those are, compared to the aerobic exercise, much more prone to impairment. Cognitive consequences, almost broadly, in such things as reaction time, fine motor. Fine motor movement is affected more than gross motor. Memory, for example, consolidation of motor tasks, which obviously is important for most sports, decision making, and it also has greater variation in mood stability with partial sleep deficits as compared to no sleep deficit. And we'll get into this a little bit, but some of these things in particular, like the cognitive and mental impacts of partial deficits, are then linked down the line to overreaching and overtraining. And so it can lead to injury and illness, in addition to like the impact on immunological and just essentially the sleep deficit itself leading to illness and injury. It also is impacted through mood overtraining and the mood's relationship to overreaching and overtraining. So basically, when you look at it and think about it, what is being affected, both physical, I guess all three, physical, cognitive, and the more emotional parts that are all related to performance. So, so recovery sleep is really important, and I put with an exclamation point and question mark there, just because a lot of the literature is like, this is the most important thing really for like athletic performance. Cell growth and repair is happening, muscle protein synthesis is happening, and just in general, sleep, all of those things are deficits. And on top of it, even at baseline, the importance of sleep is just necessary, even on a day-to-day basis for athletes. So other effects, and some of these were mentioned already, but other effects of sleep that's not particular to sports skills, although I mentioned some of the ones on cognition, but not specific sports related skills, but obviously related to athletes and athletic performance. Sleep deprivation actually it can moderate or cause pain. So someone can actually feel more pain. We always think, oh, the pain's not in my head. Right, it's not like made up, but pain is really impacted by mood and sleep and all of these things. So someone can be feeling more pain, and that's not in a good way, like acknowledging your injury. If you sleep, you're not going to, ignore your injury or something like that. But once you have the sleep deficit, you're feeling more pain, the pain is impairing your sleep. So another one of these bidirectional loops, or bidirectional relationship, or basically a loop where pain causes sleep deprivation and sleep deprivation causes pain. As I said, cognition effects on alertness and performance meaning goal-directed behavior requiring mental effort in this place, not just overall athletic performance. Consolidation of memory and next day learning, again going back to the fact that sleep is an immunological state as well. There's a relationship between inflammation and sleep deficit, so there's that increased risk of illness, and part of that is through immunological and inflammatory pathways. With regard to metabolism and endocrine function, sleep, which is so interesting, is related to obesity and diabetes, obviously insulin resistant if it's related to diabetes, control of appetite. People feel less in control of their appetite and have overall increased intake of food. So again, this isn't necessarily talking about like a 40-meter sprint, but it is talking about all of these things that are really implicated in how well an athlete's able to perform. So in general, what does sleep look like for athletes? Well, we said that they require more sleep. So what does it actually look like? Athletes in general tend to have a longer sleep latency, meaning it takes them longer to fall asleep, and they tend to have poorer quality sleep, which doesn't make sense necessarily when you think about the fact that exercise is supposed to increase and be restorative, but it's related to a lot of the lifestyle and training things. So with regular training, poor sleep hygiene, caffeine, late training, early morning trainings, insomnia might be related to anxiety. So not just, difficulty sleeping, but also insomnia, kind of anxiety related insomnia, or if a workout's too heavy or too late, the timing of it can disrupt sleep as well. And then there's like the temporary causes for sleep disruption with an athlete, travel, jet lag, staying in various places, noise, just those things that they might not have as much control over, but is like, depending on, the level of performance, if someone's traveling, I mean, these are things that are unavoidable. So it's really important to control the things that can be controlled and to recognize the importance of sleep, because if you know that something's going to be disrupted, before a performance in some sense, having a sleep deficit leading up to that is really going to impact someone's performance. And in general, athletes tend not to be aware of the problem with sleep because, I mean, there is probably a million reasons why, but they're focusing more on some of, the other aspects that are attainable and goal-driven, and no one's really talking about or focusing on the sleep. So they need more sleep, they get less sleep, longer latency and poorer quality, and they're not as aware of the problem. Some other characteristics for athletes. This was just kind of interesting one-off studies. So, kind of like factoids. So people that are in individual sports tend to sleep less, and female athletes tend to sleep less. That's compared to male athletes and compared to team sports. Sleep disorders tend to be most common in strength, power, and contact sports. I think I already said that's repetitive, but sports requiring speed, tactical strategy, and technical skill are most sensitive to sleep deficits. And in general, athletes kind of lack tools to improve sleep because it's not focused on. One thing that people are probably familiar with is overtraining syndrome. So this is a chronic training fatigue. It's basically a maladaptive response of the body where people are not getting enough rest with exercise. It's part of that overreaching, overtraining. And since actually overtraining, I mean, there could be a whole talk on just the relationship with sleep and the various biological factors for overtraining syndrome, but it is said to be both an immunologic, neuroendocrinological, and musculoskeletal state. And so when you think of what sleep is, we've said all of those things that are regulated by sleep. And so the importance of sleep to avoiding overtraining syndrome is really paramount. And without it, people can really overreach, push themselves, their performance, despite having, despite exercising, the performance declines over the course of months. And, as I said, sleep is really important for avoiding it. Those are just some of the other characteristics of overtraining syndrome, which I'm guessing people are familiar with. Another particular kind of sleep disorder that's just bears, I guess, is worth discussing is sleep apnea. It's, that slide got doubled. I'm not going to play this unless it plays itself, but it's a video that Shaq made on his own sleep apnea. But sleep apnea overall, you've probably heard obstructive sleep apnea, people wear the mask for it. It's just important that people have this screen for, especially if they snore, and people might know that if they're traveling for team sports, roommates or be aware of snoring. It's important to get get sleep apnea checked out by, that's the video, the Shack video is talking about how they tested and everything, but in a sleep lab, because this is one of the things that is going to decrease sleep quality, is that people are going to still be sleeping, quote unquote, but they have those micro awakenings where they're not sleeping, and decreased oxygenation to the brain. So they're increased daytime sleepiness. And there's a whole panoply of things that come with sleep apnea that, you know, doctors specialize in this, for example, so I won't go into all of them, but it does affect blood pressure and mood and kind of all of these other things, but just kind of noting in particular that sleep apnea is a particular problem. Actually, data shows in NFL players and other people on kind of the professional football path. And so that's important. I'm going to skip the next slide, but that's a pretty good video if you ever, you know, want to show someone something about the importance of getting tested for sleep apnea. So that's a lot to say about, and a little bit more than halfway done. It's a lot to say, you know, about the importance of sleep, what it is, why it's important for athletes. And, you know, you can't even get into every single little thing about it, but the overall picture is that sleep is really important in general and particularly important for athletes, whereas deficits can lead to some pretty significant problems. But what can we do about it? Well, there's a fair number of studies that actually look at what can be done for athletes, particularly for sleeping. And those kind of come into 3 different categories. One would be increasing the total amount of sleep, which is kind of the obvious one. But that would be just one category of intervention. And that could include napping too. The second category would be sleep hygiene. So that would be to improve kind of the behaviors associated with sleep around bedtime and things like that, so that you can get that restorative, high quality sleep. And then also another category is these kind of post-recovery strategies that are aimed particularly at sleeping or improving sleep after exercise. So what do the studies show for the first category? Sleep duration. So in these studies, they showed they were trying to have athletes get as much sleep as they could, encouraging napping, but aiming for that 9 to 10 hours a day. And these are all the things, even for 1 week, some of these trends showed. So it shows like in 1 week, this improves. They haven't done longer studies, but I'm guessing that you would probably show even improved accuracy, but these are from all different studies. So obviously reduced sleepiness if you're sleeping more, but faster sprinting, better free throw and 3-point shots, serving, tennis serving accuracy, swim turn time, kick stroke efficiency, swim sprinting, better reaction times in general, more vigor, less fatigue, better mood, better endurance, and better awareness of one's body. So again, this is just in 1 week of encouraging as much napping as possible or as much nocturnal sleep as possible. And you can see there's like specific things that are impacted, specific skills and measurements and times that are, you know, become improved. Another study showed, this is interesting, that 90-minute naps didn't have much difference in performance. So in this study, it wasn't like get as much sleep as you can. They specifically looked at the duration of naps, but 90 minutes didn't seem to really help in performance, whereas 20-minute naps did, for example, improve sprint times. If someone's already sleep deprived, 20 minutes is probably too short, but this is people that aren't even necessarily sleep deprived. These are people that were sleeping relatively well at baseline. And characteristics of a good nap should be that they are later in the day and after exercise. Again, it depends on someone's training schedule, but those are kind of, you want a 20-minute nap later in the day, possibly after exercise if possible. Now, sleep hygiene wise, what do the studies show? Basically, this is about habit building over a long period of time, and it shows, for example, if someone is encouraged to do these things, again, even a short-term course, and that's going to build better habits, but setting, you know, the same time to bed every night, no matter what. Let me shut the door. Hold on, my dog's barking. So a set time in bed and a set time with lights out. You know, if someone's going to use their phone, use it for a little bit, we'll see that that's not even good, but set time for lights out, set time into bed, sleeping in a dimly lit and cool environment. Think kind of like a cave, optional sleep aids, things like earplugs, white noise machine, and not using, you know, cell phones in the bed. And basically, again, in a short time period for athletes, it showed greater sleep duration, better sleep quality, improved soccer performance, improved fatigue and vigor, and just in general, people shifted toward becoming more of early birds. Even if their chronological type was different, they shifted more toward becoming early birds. Another thing that can be considered is adding bright light therapy. You can get light boxes. I live up in Philly, and so I do use a light box during the winter because I don't see much sunlight. But you can add that too to kind of make sure that that sleep-wake schedule is pretty set and routine. And then that third category that I mentioned was these kind of specific things for post exercise recovery, and that included cryostimulation and red light irradiation. Basically, this was, for example, the cryostimulation was daily dry air cryostimulation for 2 weeks. But both of these post-training recovery strategies, we're looking at both the impact on sleep and on performance. It didn't show much for performance, but again, it was kind of minor, but it did show improved sleep initiation and improved sleep maintenance. So if that were carried over a longer period of time, it might seem better on performance measures, but at least as far as these studies, it didn't show much. So overall, what the interventions show, if you're improving sleep, amount of sleep with napping, kind of considering the recovery strategies and having good sleep hygiene, and have improved relationship between sleep, performance, and recovery. It really shows important improvements in very specific sports skills. So some of the ones that were affected by almost every intervention were reaction time and shooting accuracy. You're going to have less overreaching, less overtraining, less of the overtraining syndromes, improved psychological fatigue, so definitely better decision making, important, showed performance improvement for team ball games, and it's important for maintaining motivation overall, which is important for everyone. They were looking specifically at athletes as marathon runners. There's a couple sleep scales that don't even have to be like, you don't have to go to a physician to get them. They're right online. One is the Pittsburgh Sleep Quality Index, which has 19 self-rated questions and 5 by a bed partner or roommate if one's available. I just wanted to give a couple examples. I'm not going to, you know, show all the questions and everything, but there's also an athlete morningness, eveningness scale, which is showing that chronotyping for the circadian rhythm, and an Epworth sleepiness scale. So that's not about sleep itself, but it's about how sleepy someone is and their likelihood of falling asleep during 8 separate activities. So what would be the overall kind of recommendations for athletes in sleep? We're looking at recommending 9 to 10 hours of sleep, trying psychological regulation techniques like relaxation. I know the last talk I gave on this, I talked for this journal club was talking about various meditation apps, the Calm app, the Headspace app, things like that people can use for guided mindfulness regulation and meditation before sleep. Daytime naps, again, looking at closer to 20 minutes later in the day and possibly after exercise. You can have delayed recovery sessions. So, for example, if someone's building up a sleep deficit, really focusing on getting a full night's sleep, especially before, you know, if someone's leading up to an important performance and they might not get it that night before or something. non-stimulating pre-bedtime routines, and we kind of went through those sleep hygiene, but the next 2 slides I'll show kind of specific as you could give them to someone and read tips. Because what I find being in medicine is like some things that might seem obvious for sleep hygiene just really aren't. And so, just no electronic devices after lights out, that's so important. Consistent sleep-wake patterns. So one example could be if someone is going to travel somewhere and has, going to be on jet lag or something like that, actually setting up to sleep, wake, and eat a little bit before the trip, to establish that routine beforehand. Obviously, depending on the travel schedule, that can get hard, but that can help someone that adjust to sleep, adjust to jet lag and the impacts of performance that has. And pain management is important if someone's having pain, if an athlete's having pain, to have pain management, for all of the separate reasons, but also for its impact on sleep. In general, avoiding medications, unless there's a sleep disorder, in which case, going to a sleep specialist, a physician, and discussing that, preferentially a sleep medicine doctor that's not necessarily just primary care and going to give medications without knowing, for example, if there's sleep apnea or something like that. But the general thing is to avoid medications unless someone has a sleep disorder. So that would include even the over-the-counter things, like so many people take Benadryl or, NyQuil or something like that for sleep, but they can have their own impacts on sleep, sleep quality and actually the sleep architecture that goes on. For example, this isn't a medication, but studies show, for example, that once people stop drinking alcohol, their EEGs for sleep don't go back, the brainwave patterns don't go back to regular for close to a year. Those are the studies that have been done at the VA, but just so many things that can quote unquote provide sleep are actually impacting quality. So kind of running through, what's the number one tip that I always tell my patients is nothing in the bed except for sleeping and sex. And by which that means not using your computer, not using your TV, because what the person really wants to do is associate sleeping with the bed with sleeping. So if you're doing other things in bed, the mind doesn't naturally associate the bed with sleeping. So someone wants to be sleepy once they get into bed. That's the same reason for associating bedtime with sleepiness. You don't want someone wide awake tossing and turning during falling asleep time. It's better to get out of bed. I say, if you're not in bed, if you're not asleep in 15 minutes, get out of bed and do something until you are sleeping, get back into bed. Regular bedtime routines and rituals, this is all again about associating bed with sleep, associating, rituals with sleep. Trying to get up at the same time every morning is important. Get full sleep, naps, like I said, avoid caffeine, avoiding alcohol, avoiding nicotine. This was saying avoiding high intensity exercise right before bed, because that can actually change some of your hormones, which might impair sleep. So exercise is important, but not high intensity exercise right before bed if someone has any control on that. Making sure the bedroom is quiet, dark, and cool. I don't know how much people can see this one, so I'll just read some of it. Avoiding blue lights from screens 2 hours before bedtime, because blue light basically suppresses melatonin, so it's almost like you're taking a wakefulness aid. Bright sun is important in the morning. If not, you can use an artificial light. Not hitting the snooze button, which impairs sleep quality. People aren't actually getting more sleep, even though they feel like they might be. There's dawn stimulator alarm clocks that turn red, and then I'll get into some of the other foods on the next page. The cooling body, making sure mattresses are new, things like that. And this is just recovery from exercise should not only focus on muscle recovery, reducing mental fatigue is as important for healthy sleep. So that's talking about reducing stressors in general. So for nutrition, what can that look like? Essentially, high glycemic index foods such as white rice, pasta, bread, and potatoes might promote sleep, but they should be eaten more than an hour before bedtime, so not eating carbs, high glycemic index carbs right before bedtime. Diets high in carbohydrate in general help people fall asleep easier. Diets high in protein improve sleep quality. So there we have like basically carbs help you go to sleep easier, and diets high in protein improve high quality sleep. Diets high in fat, however, are the things to avoid. They reduce overall sleep time. Caloric intake in general is important for sleep. Like Seinfeld or something you've seen in TV shows talking about turkey and sleep. So tryptophan can be in turkey or pumpkin seeds. Melatonin is over the counter, but it's also available in foods. And some people suggest valerian, but in general, that can have interactions with other medications and things like that. And just going back to this, that repeats some of it. Another idea is magnesium, oral magnesium or topical magnesium. Melatonin, some of the foods that have natural melatonin in them are tart cherry juice, raspberries, goji berries, walnuts, almonds, and tomatoes. So that, trying to get melatonin from there rather than necessarily using supplementation. Another thing, just I guess kind of about diet, is not like drinking too much of anything that's going to make you have to get up and go to the bathroom during the night. So one of the last slides, there wasn't much on this, but this was actually kind of interesting. I don't know if people have heard of lucid dreaming, but lucid dreaming is when people are aware that they're dreaming and can control parts of their dreams, or control significant parts of their dreams. And so there are some studies looking at kind of dream practicing, and that it might actually improve performance. So if someone intentionally learns to lucid dream, I mean, this is getting a little out there in terms of general recommendations, but I thought it was just pretty neat that people might actually be able to increase their practice time by practicing their sport during sleep. And essentially, the studies that we're looking at it, we're saying you still need those rest and recovery nights. That's important, and to schedule these kind of dream practice nights separate from the recovery nights. So I left about 10 minutes for questions if people have questions, but I just wanted to put up the citations. I tried to take a lot from meta-analyses and reviews, so you can look at those. The most recent one, I think, is that 2009, those two 2019 ones. The last one listed, I think, is pretty good if you want to look up like one particular study that reviews most of it. But I don't know if people have questions, or that is it for my talk.
Awesome. Well, thank you. This is great. As per usual, we had a great mindful performance, great sleeping for performance, all the good things. Okay, Marion just asked a question, and she asked, does the literature say that lucid dreaming affects quality of sleep?
That's interesting. Like I said, I didn't see so much into it, but I do think they were saying it impacts a little bit the quality of sleep, which is why kind of having this separate lucid dreaming scheduling in addition to the recovery. You wouldn't want all, I don't know that much on the literature, but I'm pretty sure that what I read said it does impact, because you're having, when you think about it, you're having more REM, you're having I guess more active sleep. So if you were lucid dreaming all the time, I think that would be impacted, but maybe on occasion, no.
Okay, our next question comes from Jennifer, and she is asking if there's any research on CBD and sleep as an intervention.
I mean, I didn't look at it specifically for athleticism right now, but I just know in general, I think that the colloquial attitude toward is proven better than the research so far. People in general subjectively feel that their sleep is improved, but so I guess it could improve quality, but in general, like measures of sleep aren't improved. So I don't know if it's more of a placebo effect or if it's just actually some kind of refreshing quality to it, but the other markers haven't borne out as much from my awareness.
Okay, the next question comes from Josh, and he's asking about if there's any evidence on weighted blankets with sleep.
Oh yeah. I think there is, I mean, especially I think for anxiety, and I'm not sure about in general, but I know there is some for anxiety. I have one, but there is some data. I recommend those sometimes. You know, I don't know how practical it is in Florida, but you know, people in general want, you know, big comfy blankets up here, and I do recommend getting a weighted blanket because I think it helps with sleep quality and some with sleep latency. It's not for everyone. Some people are affected by them and they don't like them, but I think it's an intervention that's like, you know, someone's going to know whether it's helpful or not and whether they like it or not.
And I already keyed up the Shack Attack sleep video.
Oh yeah.
I'll watch that after we finish.
Cool.
So I'll give it another minute or two if there are any other questions. That was very good information. I had mentioned that there was a talk at the AMSSM, which is the National Sports Medicine Conference.
Mm-hmm.
I've looked at how much, not necessarily sleep, but we were talking about schedules of what the schedule was like, and then how much expected jet lag they were going to have, and then predicting based on that which team was going to win.
Wow.
And had a very high success rate on predicting which team was going to win just based on where was the game, where were the teams traveling from, what was the time.
Wow.
Up to it.
That's really interesting. Yeah. So which definitely relates to this. Yeah, that's super interesting. And there was also some studies showing too, like athletes tend to go into sports that meet their kind of chronology, I guess, which makes sense. But I can imagine for some people that, you know, some people jet lag's a lot harder for, also based on kind of what sleep type they have. But that's interesting. You shouldn't let Vegas know about that. It'll ruin all the brackets.
All right. Let's see. Angelica asked, you mentioned not going to bed until you are ready to fall asleep. What would you suggest for waking in the middle of the night and the inability to fall back to sleep?
Yeah, I think that's really important as well. Like so that whole there's a couple apps for it too, CBTI, cognitive behavioral therapy for insomnia, that you can use that kind of talks about this sleep training. But again, it goes back to this fundamental principle of not being in bed unless you're asleep, because then your body like learns to link being awake with being in bed. And so, you know, the first night that relationship doesn't develop, but if you're waking up every night at a certain amount of time, it gets harder and harder to fall back asleep. So obviously it depends on roommates and housing and kind of all this stuff, but getting up and not doing computer stuff, which is really hard because most people kind of roll over and grab their phone and look at some stuff at their phone, but then that's suppressing melatonin and changing your sleep to begin with. So getting up, reading, you know, kind of chore-like things, things that make you tired, that are boring during the day that you don't want to do, but, you know, reading, but getting up and doing it out of bed is really important.
and the rest of the questions for today. So thank you. Thank you very much, Michelle.
Thank you. Thanks for having me.
Absolutely. Thank you everyone for attending. We'll see you at the next one.
Take care.